We're going to pause and take a few phone calls. Go ahead, caller.
Yes. If you have your results back and the lead in the water is supposed to be 1 ppb and you don't have a 1, or is a higher, is that something that I should be concerned about?
You should always be concerned about the amount of lead in your water. 1 is okay. Actually, the action level by the government, which really doesn't include all the health issues, is 15. We're trying to get it dropped down to 10 parts per billion. Ideally, 0 is the best, and that's why we're continually encouraging people to flush their system in the house, run it for 5 minutes after a prolonged period of like sleeping overnight, or if you go away on vacation. And that's why we insist that for lead and the problems related to lead, you must use a filter, and you must use the filter properly. If you don't know, ask the core team to come to your house, and they will actually set things up for you. The important thing is that you change the filter whenever you see that red light. When that green light goes out or starts blinking, change the filter. We would even recommend that you change the filter every 3 weeks to deal with the lead issue. Now, one of the challenges with filters is they remove chlorine, which kills germs. So we ask that you flush your filter that is attached to your spigot 15 seconds just to clear as much of whatever may grow in the filter as possible. Because as we all know, we weren't raised in a water system where everybody was required to use filters. So back to your question, 1 means you're headed in the right direction, and I would continue to use filters and make sure they're being used properly. Flush your lines and get your water retested again. And I'd say you can do it a week from now, 2 weeks from now.
Okay. I was recommended to do this from the water site people because of a cloudiness in the water.
Because of what in the water?
The water is very cloudy.
It's now, when the water comes out the spigot, if you have a sprayer type, it may look cloudy. Does it look cloudy once you hold it in a clear glass container?
Yeah. Yes.
I think that deserves further investigation.
Yes, that's why he had me to get this testing done.
All right.
And it's still like that. And I mean, it's consistent, with doing dishes and stuff like that.
Yes. Now remember, you can't see lead under most circumstances. There's the dissolved part, and then there's the little black particles that you may be able to see. But because you can't say, because I don't see anything, everything's all right, no, you must get your water tested. And that's why we have been recommending that if you have any question, use water from your cousin's house who lives in another city across the city line, or use purified bottled water.
And is there somewhere where we can get a class on, like, the understanding of the written form of this?
Well, there are sites online, and I will tell you, even those from the health department and the government present challenges, because this really is a new situation where an entire city has been affected by the lead problem, and we're learning new things almost every week. And because we have one problem solving one problem may generate another problem that we have to address. So your question about a class is very good. And the fact that you're listening right now, we hope we've given you some information, but we will have to contact some of the universities or see what we can do to do that. Now, okay. I'm not saying we're all that smart, because you must understand there's like 10 of us who are meeting every week for at least 2 hours, twice a week, trying to just absorb all this information and translate it in a way that we can make it clear. I have to make it clear in my own house.
Right.
So, do you mind if you can call back and give us your phone number, and we can follow up with you on some of your specific individual questions?
Okay.
Thank you for calling.
Thank you, and have a blessed day.
You too.
Thank you.
Caller, you're on the air.
Hi. I was just calling because I read online that the governor was supposed to make sure that there's water deliveries door to door. And I'm just wondering, is that happening? And if it's not, is there anything that the citizens can do to make sure that that does happen?
Currently, there are pods that are open for residents to receive water. There are certain populations that are having water delivered to them. We would have to get more information from you to determine which one of those populations you would fit in.
It's not for me. I think that this is not the citizen of Flint's fault, and they shouldn't be stuck with the inconvenience of coming up with gas money to go to the pod. It's not their fault, and that shouldn't be an expense that falls onto them. They're paying for Governor Snyder's defense fund. They shouldn't have to pay to go pick up water as well.
We agree.
Okay, thank you.
Thank you, caller.
And remember, it's important that you use those water pickup sites, because if a site has fewer than 20 visits a day, the state will shut them down within a period of time. So use those sites, because speaking as a Flint resident, we cannot give our state government an excuse to shut down the water distribution sites that already exist.
Good questions out there. I think that we will next week have somebody to come in and talk about the ongoing studies around the filters.
Yes, we'll have members of Wayne State and University of Michigan who are doing the Legionella as well as the filter study, and they will be here next Tuesday, which is May the 9th, and they will be here from 6:30 to 7 o'clock p.m.
I think that's excellent, because there's a lot of good work that's going on, and it's very important to understand how to use these filters safely. Really, nobody has designed a water system and planned that we would have these filters at the point of use all the time, but they're necessary right now because of the lead. There is the potential for an increased infection risk, and some of the things Dr. Reynolds alluded to is that for lead, these filters need to be changed whenever the light goes on, but for potential infections, it's probably important to change them more frequently. We're not sure of the exact right number, but some people have suggested every 3 weeks would be good. Additionally, as Dr. Reynolds was saying, you have to make sure to flush the water through for at least 15 seconds. And again, for people who have any kind of immune problems that I mentioned before, those people should really only be drinking purified bottled water. We are still investigating to see what other kinds of infections that we might need to look for, but certainly for Legionella it's a concern. And I think also anybody, it's clear that has a fever or any kind of a bad cough should go and see their doctor immediately. Legionella has decreased in the community, but it is still a potential risk, and we wouldn't want anybody to wait.
Thank you. Really great information. And Dr. Reynolds, as you've mentioned, we find ourselves in a different place with this water crisis, and we are working together as a broad cross-section of experts trying to sift our way through this information. And as residents bring us different concerns, those are not falling on deaf ears. We're actually taking that information and making sure that we're testing and or just reading the research and really questioning one another about the various issues that come about. One of the questions that definitely came up at the town hall meeting a week or so ago was adult lead poisoning. What are some of the impacts of adult lead poisoning? We have research that talks about acute, but we don't usually look at the chronic low dose poisoning or exposures to lead, and we know about what those symptoms are. Can you give us a little bit on that, Dr. Reynolds?
Well, see, if you've been exposed to lead as a child and through your life, lead does show up in the blood, but once the level goes down in the blood, it's also stored in the bone. So when you have certain events like pregnancy, breastfeeding, some inflammatory conditions, thyroid disease, and those things you can discuss with your doctor, that causes the bone to mobilize calcium, which is the good stuff. But if you have lead in there, which is the bad stuff, that will move the lead from your bone to your blood. And then that makes it available to do damage to cells. So this is what one of my colleagues, Dr. Carravallah, calls the evidence desert. We want to know what is the effect of this long-term, recently released lead in the blood in adults. We have some concern and some pointing toward it may cause diabetes, heart attacks, hypertension, or high blood pressure. So these are new areas that we have to start looking at, because in the past all we did is look at people who had nerve damage, couldn't walk, were comatose, or who were having seizures. It can also cause kidney problems and gout. So does that mean that lifelong exposure to lead and its mobilization over time will cause kidney disease and cause someone to have to go on dialysis? These are things that must be investigated. And it can cause gout, that painful big toe that you can't even lay a sheet on. So these are concerns, and I'm speaking as a senior citizen now.
Thank you. We have one more call, and we'll take this one last call. We didn't get through everything that we wanted to get through, and we have some upcoming sessions. As we've mentioned, the next one will be May 9th, which will focus on the Legionella study, and that's 6:30 p.m. to 7 o'clock p.m. And then we'll have Dr. Monahan Atisha talking about some of the activities and some of the programs and some of the work that's being done to address the water crisis. We're going to take this last caller.
Hi. My doctor ordered
Ma'am, we're having a hard time. We're having a hard time hearing you.
Can you hear me now?
Yes, we can hear you better.
Okay. My doctor ordered a bone density test. I'm wondering if that would show any type of lead in my bone.
So we're going to take this call offline. We're going to hang up so we can get rid of the background noise. And Dr. Reynolds or Dr. Carravallah? Bone density testing. Her doctor prescribed bone density testing.
Bone density testing, excuse me, usually doesn't pertain to lead, but is more an issue where we worry about osteoporosis, where people may not have enough calcium in their bones, and their bones can become more brittle or break. And so it's a very important thing for people as they get older, for women especially if they're past their menopause or past their change of life. But I am not sure how it might relate to lead, so I think it's a separate issue.
Unless she was talking about bone testing, and there is some bone testing that's being done because the half-life of lead in the bloodstream is far less than it is in the bloodstream. Is far less than it is in the bone.
Right. There is something called immunofluorescence. It's a special kind of bone testing. It's different than the bone testing that we normally do. Currently we don't have a machine for that in Flint, but we're looking into it.
And Dr. Reynolds, as we're wrapping up, what are some of the things that you're suggesting that we do to ensure that our children have a brighter future, even in this time that we're in?
Everything that Grandma and Auntie used to do. Read to your child. Sing songs to your child. Turn off the TV. Turn off the radio. Make sure you feed your child healthy foods that have, and that's fruit, fresh fruits, even frozen fruits and vegetables, so that you get more calcium that will reduce the amount of lead from being absorbed into your body and your child's body. And so remember, read, sing, and play with your child. Turn off the TV and the radio at least an hour a day.
Thank you. We really thank this group.
For the past 30 minutes, you've been listening to the City of Flint Health Town Hall discussion. Be sure to join them next week at this same time on the best variety of gospel music, the new 1420 AM WFLT.